Good morning. It's Tawny Peterson, nurse practitioner from Adams County Health Center. It has been a while since we have talked about the coronavirus. I think that we're all just pretty well wore out on the topic. But at ACHC, we got together this week and we talked about what our topic should be for the live feed. And we decided that it was time for us to bring up the coronavirus once again. We are seeing these numbers in Idaho climb on a daily basis. There's a lot of controversy surrounding the topic, as we all know, a lot of very strong beliefs and feelings. And I just want to take a moment this morning and talk about the reminders that we at ACHC feel is important to share with our patients. And as I've said in the past, we put into protocol immediately at the clinic procedures to keep our employees and our patient population safe so that when they do come to the clinic, they are not at risk of contracting the coronavirus. I know that none of us are exempt from getting it, and all we can do is our very best to try to prevent from getting it. So at the clinic, we're still doing curbside delivery with prescriptions. We're still screening every patient. We're keeping the foot traffic at a very low level inside the clinic. We can continue to see patients in dental and optometry, physical therapy lab, the medical side. Our pharmacy's open, we're doing x-rays. So that has not changed, just our protocol for keeping everyone safe. What I'd like to share with you today is that one of the things we're educating our patients on is the fact that get over the notion that the coronavirus is most deadly or dangerous to the elderly or the high-risk population. Although we all know that the elderly population and our high-risk population is always at a greater risk of becoming sick or more sick than the general population. What we're finding with the coronavirus is that it just does not discriminate. It still remains the same that many people who get the virus will be asymptomatic. They may not even know they have the virus, or they may get very mild symptoms. It's been real interesting for me because I have seen so many people in my circle contract the coronavirus, and luckily they've all been mild to moderate sick or asymptomatic. And so it would be very easy for me to believe that this is nothing for us to worry about, and it's no worse than the flu and all of that. But I will tell you, because of being in the medical field, this is a virus that you don't want to contract just because of the fact that it does not discriminate. And we saw this last week when we lost one of our fellow medical providers, the nurse practitioner from Canyon County, young, vibrant, very well-loved woman. And it's been a real eye-opener to all of us that all of us can be at risk. I know that we see the nightly news and there's always the scares, but pay attention to those because, yes, those numbers are low. The odd stories, the children and the young people and multiple family members and all of that. Yes, it makes the news because it's frightening, but that doesn't mean that you or me or any of our patient population is exempt from those same stories. So what can we do about it? It's the same as we've been told from day one, and that is social distance and frequent hand washing. We'll get into masks next. Social distancing is vital, and it doesn't mean that you have to stay away from people. It means that you need to stay back from people, and you need to stay out of large gatherings. If you want to go to a large gathering, you have to wear a mask. But the thing is, I don't think there's anybody that really likes people in their personal space anyway. So that let's be extra mindful of that right now. I don't want to get up in somebody's face, nor do I want somebody close into my bubble. So let's just be careful with that. Let's stay our 6 feet back when we're able. Frequent hand washing, many people have said to me that that's one area that they have fallen down on. And I appreciate the honesty. In the beginning, everybody was washing their hands. So let's get back to that. Wash your hands frequently. Wash them for 20 to 30 seconds. Scrub them, rinse them, dry them with a clean towel. and use your hand sanitizer when you're not able to wash with soapy water. And the other is masks. It's hard to even talk about masks because there's so much controversy revolving around mask wearing. And all that I can tell you is that by wearing a mask, you will prevent the spread by up to 80%. You very likely could be asymptomatic. Your next door neighbor could very likely be asymptomatic. We don't know who is carrying the virus. It could be our own self. And by wearing a mask, we're protecting others. We as well do get some protection. That all depends on the level of the mask. But I do know that when we sit in our meetings at Adams County Health Center, the one thing that is said over and over is that we do not want to be responsible for spreading that virus. As an individual, that's something that we do not want to do. So think that over. They're not easy to breathe in. It's not easy to talk in them. People can't hear you talking well. But I can't stress the importance of mask wearing, hand washing, and staying 6 feet apart from one another so that we can be done with this topic. I, for one, am sick of it, and I'm tired of things being canceled, and I'm tired of the controversy over it. And so let's do our part and be done with it. Okay, that is it for our coronavirus spiel this morning. ACHC loves local. This week we are spotlighting Granite Mountain Cafe in New Meadows, one of my very favorites for breakfast and lunch. They make an amazing burger. And so what you need to do is go to the ACHC Facebook page, like and share that ACHC Loves Local. Go to Granite Mountain and like their Facebook page so that we can promote their business. And I will see you all next week. Thank you and have a great sunny weekend.